Just a brief bit about me. I'm an academic. I'm the head of the Melbourne Medical School. And in our medical school, we run two relevant programs to today, the Master of Genetic Counselling and also the Master of Genomics and Health. And I'm really excited to be involved in this panel. And we've got some wonderful panelists who we've just had a lovely conversation and photograph outside. So we're ready to go. And I think it's pretty important because consumers bring critical perspectives to issues in all aspects of healthcare, not least genomic care. And just what comes to mind to me are aspects around data and privacy, consent, issues such as that. But I think we'll find in our conversations that there are many broader implications of genomic care that the lived experience will draw to our attention and help us navigate through. So with that in mind, I hope you join this panel this afternoon, and we'll get kick-started. I'm going to ask my first question. In fact, I'll ask the same question to all the panelists, but Lucia, we'll start with you. What led you to be here on this panel today? What's a little bit of background that you can tell us about?
Thank you. My name is Lucia. I'm just a mere parent of a child with a very rare syndrome. Our journey actually started overseas. We never had Melbourne on our map of a place to settle down, but we came here because of the good genomic care that Melbourne has to offer and of the great medical and allied health therapy team that is here. So we left everything behind and we moved here 2 years ago. From my perspective, being in this journey for 2 years and throughout our different challenges and the positive stories, I just wanted to help advocate for other families and for other children that might be still in the journey of not knowing what is impacting them or what is the root cause of their disability. So this is what I'm really driven about, just to be an advocate for families and people with rare diseases.
Thanks very much. I think you've come to the best state in the world, so let's hope that we can help your family. So we hand over now to you, Bonney. Same question, why are you here?
Thank you. In a similar tone, my family's from a tiny island called Guernsey. Has anyone heard of Guernsey? Is anyone from Guernsey? Any relatives in the crowd? It's a tiny island off the coast of France, and a number of my relatives are first cousins, being a tiny island without a lot of migration history. And it's meant that we have a whole lot of genetic variants in our family, and I in particular have a BRCA1 mutation along with a raft of other sort of rare diseases, and have ended up here because of great care pathways that exist in Victoria. And I am 42 this year, and I will have outlived the majority of my grandmothers who had the same mutation, and I'm the oldest living person in my bloodline with these variants. So I'm also sitting here today because I really appreciate the work that all of you do and the importance of bringing genomic care into mainstream healthcare, because this really is the future of care. And it needs champions who are consumers, but also providers and advocates to really advance this to the level that we need to rapidly.
Matt Le Tissier, the famous football from Guernsey. I looked him up, it's true. So hand over to you, Elly. Same question. What leads you to be here on this panel?
Thank you for inviting me to be on the panel. I feel very lucky to be up here. So I'm a genetic counsellor. I've been working as a genetic counsellor for the last 20 or more years. And I think, like Paul said this morning, that when he first started ordering testing, it took a year to get a result back and cost a lot of money. And I guess over the 20 or more years that I've been working as a genetic counsellor, I've really seen the change that's occurred in terms of what we can offer and the answers that we can provide for our families. I work in Melbourne at the Royal Children's Hospital, but I'm also really lucky as part of my role involves providing a service up in the Northern Territory as well. And so I think I can see the perspective of a well-resourced metropolitan hospital and perhaps a less well-resourced hospitals up in the Northern Territory, and the differences that exist when health professionals are trying to order genomic testing for their patients, and I guess some of the challenges that they face. So yeah, that's me.
Well, thank you very much. So I'd now like to ask you, particularly the consumers on the panel, what does genomic care actually mean to you?
Genomic care to me means a whole lot of things around sovereignty, around data and Indigenous data sovereignty generally. But at like its most simplistic form, I think of it as though genomic care is healthcare. And that is something that not everyone believes. I have people in my immediate family that don't believe that. I have people in my close life that think I've been tricked into this care routine that I'm in, and that this is all a part of the brainwashing that happens around sort of conspiracies. And I have literally outlived my grandmothers. Like, there is very real evidence of me sitting here today and being alive today thanks to genomic knowledge and understandings. But that access to information and evidence and science is not accessible to most communities in the world still. And so I think for me, genomic care being healthcare is a really, really critical message that we still need to get out there. And on an interpersonal level, for me, genomic care is preventative and it's healing. So it's a combination of preventative health, but then it's also a really important part of our responsive health system and part of healing, not just physically, but socially, emotionally, culturally, spiritually.
And same question.
For me, and having also been part of some of the workshops, I think I would conclude it to 4 different aspects. One is how genomic care is really centered around the patient, so patient-centered care. And within that, it has a lot to do with how there is a collaboration between families, the patient, as well as the healthcare providers, how everything is around the need of the individual patient, and how the communication with the patients around consent, risks, benefits of doing the genetic testing to be able to actually have a say and understand what are your options and make an informed decision is very important. And secondly, how this becomes actually a multidisciplinary approach where genomic care should be included in the routine practices of all the healthcare aspect, being, as Bonney also says, being put more into the mainstream channels so that all families can have access to it, which is that equitable access approach. How do we look at all the cultural sensitive aspects, the language barriers, the socioeconomic barriers to actually make it accessible for them all? And then the fourth one would be we're all collecting data with genomics, whether it's with the different conditions or whether it's the opportunities of developing better care or the cost associated to it. So all of these evidence base needs to be put into a proposal that actually can help make these whole genomic studies more approachable to everybody. Yeah. So sort of in 4 different aspects I look at it. But for me, specifically from the consumer perspective, my biggest take has been that collaboration and that triangulation between the healthcare providers, the families, and the patients. That collaboration for me meant the difference of moving from overseas to here, because it added that humanistic approach to our journey, which for me and for my family and for my little one meant excellent care, and it completely changed the course of our journey, I feel.
I might come back to that in a minute and ask you specifically to help us co-design what great care is like, and you and Bonney can work on that together. But before we do that, I just want to go back to Elly and ask you a question. As a genetic counsellor, what do you think that clinicians or medical doctors and other health professions need to know or should know about genetic counselling and the services that you provide?
Yeah, sure. I mean, I think, and particularly in the context of the audience that are here today, I think it's important for other health professionals and medical professionals to understand that if they've got a question about whether a patient or a family has a genetic condition, they don't have to refer them to genetics, that they can order the test in a lot of circumstances now, and that there are some aspects of genomics that are a little bit unique, and I guess it's important that they have an understanding of what those aspects are. And so, I mean, often we'll get contacted by a clinician who might say, oh, what's the consent form that I need to get the patient to sign for this test to go ahead? And it's just thinking a little bit more about a consent conversation with the person or the family. So having a discussion with what's motivating this person to have testing, or why you as a health professional are recommending this testing, and what that family or person might hope to gain from that test as well. Because, you know, there may not be a cure or a treatment for a child's condition, but and that might be something that that person is very hopeful for. And so it's having a conversation with the family about what this test might help with and what it may not be able to help with right now. And I guess talking a little bit about the difference between this sort of test is the impact on the wider family as well. So that's something that's obviously unique to this kind of testing. This may have implications for you, but it also might have implications for your sister who's pregnant, or your cousin, or your wider family. So rather than just thinking about the person that's in front of you, thinking and talking to the person about the wider implications. And I guess the issue of data has come up as well, and that's something that I think there are sometimes people are a bit worried about talking about the what happens with a person's data. And so I think as a health professional ordering a testing for an individual, you yourself need to have a good understanding of what's happening, where that data's going, how that data is secured, whether that data is shared, so that you can have that honest conversation with the person in front of you, and then they can make an informed decision about whether or not they want to have the testing.
My own work brings me in contact with families of children with cystic fibrosis, and so I've seen the work close up of what genetic counsellors do. But from your experience, you described there some of the complex conversations that you're having. How do you actually manage that? What does your experience tell you about what services and what facilitates those conversations? Do you have any tricks of the trade that clinicians should know?
Well, I guess, I don't know, as a genetic counsellor, I think like any healthcare interaction, it's all about being authentic with the people that you see, and being curious about people and their story, and like I said before, understanding what motivates people. So I think being human is a big part of that, like any healthcare interaction, as I said. We as genetic counsellors, we have a lot of training in communication, and so, like I said before, a genetic counselling appointment shouldn't be a genetic counsellor giving a lot of information to a person. It's about having a conversation with that person and understanding what motivates them and what's important to them. And I don't know, I worked with a geneticist who said our scalpel is our pedigree, is the family tree that we draw up. And so sometimes by exploring a person's experience of a particular condition in their family and how that's impacted them or their family, then you can use that experience to talk to them about what it might be like for them to get an answer, or to find out that they're potentially at risk of something in the future.
Awesome, thank you very much. Now, I mentioned I'd come back to build on Lucia's 4-point master plan that she was built. So the consumers were going to build a quality genomic care program. So Bonney, what do you see? What's a really good program, or what does good genomic care look like to you?
Thank you. We did do consumer engagement guidelines, just a plug for Melbourne Genomics. Stacey Ong, I think's here. Stacey. Talk to Stacey afterwards about the guide that we put out around that. For me, number one thing that we can all do that's quite practical is like affirmative recruitment processes to ensure that people with experience of genomic variants, whether it's in their families or themselves, are in leadership positions in health. And some of that's around addressing the ableism that exists in health and the racism and the homophobia and all the different layers to make sure that the people in leadership positions of our organisations, whether they be the CEO roles or policy lead roles, are people with various lived experience. And there's still so much stigma around having rare disease and what that means as a burden on the workforce. There's still so much genetic discrimination around like the current life insurance moratorium that exists around some genetic variants. Really kind of unpacking what it means to be a leader in this space, I think, is an important part of building and strengthening genomic care in Australia, and making sure that we've got people who really understand what this is in leadership roles is one step forwards, I think.
Okay, you've opened up a very big area there. How does that sit with you, Lucia? And anything else you want to add in terms of your master plan?
Well, my little one is only 4 years old now. He was diagnosed 2 years ago, and I noticed that he had challenges already from 4 months old. And I think that as a parent, and seeing all the data, all the innovation, all the evolution that that a lot of you heard today with the different panelists, my biggest hope is that in 10 years or 18 years, this is so mainstream that nobody has to go through the journey that at the beginning we had to go through to get answers. Because once we got the answers, we basically had a very efficient model of care where we knew where to go, how to help my little one, which communities to try to seek support from, and in my case, continue to help advocate just to make it more out there. It is incredibly important, and as a parent, you don't know the amount, the incredible impact that all your work does for families like mine, where we would decide to leave everything behind and just go where we need to go, just so that they have a better future. And I think Melbourne being one of the leading places in this, and just the fast turnaround, the humanistic side of care, the constant strive to also learn to do better, because there is these conferences as well to continue to learn from each other, get input from consumers, continue to advocate with CEOs, try to move the change upward, talk about costs. This is all important conversations that are needed every day so that we can continue to improve the healthcare system and just provide better care in general. So that for me, as a parent, that would be my biggest dream. And I think that for people that has rare conditions, every day is a glimpse of hope as well. Mm-hmm. So, yeah.
And Bonney, if you've got the mic, so what are the challenges you've experienced, and one thing that you might wish to change if someone in the room today would leave and go and change immediately?
Just one.
Well, we'll see how long we have, but start with one. We'll take it from there.
The challenges, I kind of don't know where to start on that either. I've accessed healthcare in multiple different country settings, and I'm a dual citizen and ended up here with a similar reasoning of like the care here is just better. So it's, and recognising you're all here because you want a better health system too. So the challenges we experience in the system are multi-layered, but if I were to pick one, it would be around the fragmented care that exists and the fact that it's like a spoke model where as a consumer you're kind of case managing yourself, going out to all of these different areas. And while genetic counsellors are immensely helpful, there's not enough of them. And we often end up just paying privately for them because the wait lists for public support are so long. And in my experience, my family's known about these genetic variants for 20 years because of the fact we're from a small island. So we were involved in some of the first ever genomic studies, which is an immensely privileged position to be in. And it also meant that some of the first genetic counsellors I ever had wouldn't even recognise my partner as being my partner because she was the same gender, and they'd asked her to leave the room before they talked to me because she wasn't recognised as a family member. So I think the reality is until we have a strong genetic counselling workforce, we're never going to have a level of equity or inclusion that we need in genetic counselling. So that would be like one kind of barrier and then takeaway. And in terms of something that everyone can do, I think I'm a policy wonk, so I just think the answer's always in policy first, and it's around every health and hospital region, system, clinic, care model having a policy around genomics. And it seems like such a simple thing, but how many of you actually, if you think of the place that employs you or the place that you're on a board of or the kind of group that you're linked to, do you have even a one-page policy brief on what it means to embed genomics into your practice? Because most people don't have that. They might have different versions of that or try to do that in different ways. People often come back to care guidelines or clinical practice guidelines or kind of what that means to be face-to-face with the consumer, but what does that actually mean for your leadership? What does that mean for your board? And how do we get health boards to buy into that? Because I've heard a lot of conversations today about how CEOs need to change or what CEOs need to do, but they are guided by their board and the policy that their board writes. So my one takeaway would be, if you can even just get a one-pager, I'll do you a template on how to embed genomics into the various levels of your organisation. That would be the game changer. And we can do that at the national level, we can do that at state territory level, we can do that at the health region level. That will gradually get into the activity funding that we have at state levels, that will start to reach the KPIs, that will start to infiltrate on health expenditure in really powerful ways. But until we have that policy in place, it's all of you lovely, well-meaning champions doing good work in this kind of patchwork way. That means we have this jigsaw of good practice with bits missing, and the bits missing are often in the remote areas or in the communities that are already the most sort of sidelined. So yeah, that would be my one thing, right?
Yeah.
A genomic health policy in whatever place you can.
Cracking example to bring up. Not sure we're going to get through all your other potential examples. And before we ask you, Lucia, the same question, because you spruiked there the roles of the genetic counsellors, just a comment from you, Elly, about the current situation of genetic counsellors in Australia. I know we have our course. I think there's one over in Sydney. What's your own take on this? And this could also be an action takeaway for some people in the audience.
Oh yeah, thanks for promoting genetic counsellors. Yeah, I mean, I think that there are two training programs. There's the University of Melbourne and UTS in Sydney. So there are more genetic counsellors graduating now with the two courses than there were some time ago, but there still is I think that obviously funding is an issue, and there is a shortage of genetic counsellors. I know at the Children's, there are pretty much every department in the hospital would love to have a genetic counsellor embedded with their team, whether that be cardiology, ophthalmology, neurology, there is a long waiting list to see genetic services. And I think in terms of just some of the models that obviously Melbourne Genomics tested out through their last phase of work do demonstrate the benefit in some cases of having a genetic counsellor embedded within those outpatient clinics or those particular subspecialties within the hospital. So I think that there's lots of opportunity there.
Yeah, great. Thanks for that sort of state of the nation. That was very useful. Lucia, then, same question that we asked Bonney earlier. One single thing, first up, one single thing that you think might improve, or it's a challenge that's currently faced in genomic care that you'd love to see that challenge smashed?
A lot of pressure. So when we were living overseas, and this is just so that you get a little bit of a different perspective, being part of Asian countries, there is a lot of the top-down kind of approach. And a lot of the conversations that I heard from today were, well, the decision makers are the ones that need to be approving this to make it mainstream or to make it more available in the hospitals or to be making it more embedded into the practices of the hospitals, etc. So it almost feels that the challenge is we have one potential person or group, or that it's almost the key switch that you need to turn on or off so that things can happen. And when we were going through the journey, my biggest worry was that I was gonna get shut down by my concerns around my child, by those that hold the knowledge or the power. And that's the biggest concern as a parent, that you just won't have enough expertise or voice or educated enough to be able to engage in a collaborative type of conversation and communication in a very open-minded conversation that actually takes into account the patient's needs, their individual needs, and sort of tailor around it. What we did see here, at least in our personal experience and our family experience, was that was the case. But I do know that a lot of other families didn't necessarily get that same experience. So I think that if that could be lifted and maybe the quality of it gets improved even further, I think that then there is basically from here we go to Mars, and it just goes. Because eventually, like, data will come. More testing will be done, costs will be driven down. But I think that when you keep the service quality at a top excellent level, you really make a difference and you stand out from the different crowds. So then you stand out from even other genomic cares from other countries or other states, if there is a competition between different states in Australia. And that's what really drives excellent, good genomic care, in my opinion. My experience was very particular, but that's what I want to talk about it, because that's what it should be. We shouldn't be saying, oh, I've been lucky to have this opportunity. I've been lucky to have this experience of receiving the diagnosis this way. It shouldn't be that. That should be the basic. And that should be what is offered to all families, to all patients. So that's why my drive for me is how do we make this more accessible and a more common thing for everyone, rather than a good success story, if that makes sense.
You've touched on wonderful topics of equity, diversity in leadership, workforce. It's really been quite a broad discussion. I think we're coming to the end of it, but I'm going to give the last word to Bonney. So, because you had a whole list of things that you'd like to comment on, perhaps I'll leave it to you to, the closing message that you'd like to give the audience, and then we'll close.
No pressure. I would say that data sovereignty is the most important thing to think about, is that there's still people in my family and children that I'm related to that won't consider their risk or look at testing because they're worried about how their data will be used. And I think that is the kind of number one thing that we need to be talking about. And in the Australian context, that's Indigenous data sovereignty. So I think that segues well to our next panel around here, and listen to that next panel because it's incredibly important. And we can't get it right for us unless we can get it right for First Nations communities in Australia. So it's like if we can address that foremost, then we will start to address all of these things we've spoken about here. But we can't just tackle every little issue all at once. We need to be really strategic, and that's a really great place to start.
Awesome. So if everyone could thank our panel, that's Lucia, Wang, Bonney, Corbin, and Elly Lynch. Thanks very much. Real pleasure. Thank you.